Earlier this week, we told you about a Carroll ISD student who collapsed during school and later died. Doctors say 13-year-old Julio Oliveira, a 7th grader at Carroll Middle School in South Lake, suffered a brain aneurysm. Now, we do hear about adults suffering aneurysms, but is it common in children and teens? We talked to Dr. Bradley Weprin, the director of neurosurgery at Children's Health and professor at UT Southwestern Medical Center, who told us they are much more common in adults. A brain aneurysm is a weak or thin spot on the artery in the brain that balloons or bulges out and then fills with blood. It can put pressure on the nerves or brain tissue. The Mayo Clinic says most aneurysms are small, and many just aren't serious, but they can rupture, which is life-threatening. Now, most of the time, you won't suffer symptoms from an aneurysm, and unfortunately, that happens until it ruptures, especially if it's really small. If it does rupture, symptoms include nausea, vomiting, a stiff neck, blurred or double vision, and then sensitivity to light, sudden confusion, and then, of course, a loss of consciousness, even a seizure. Again, Dr. Weprin tells us aneurysms are rare in children and teens, but pay close attention if your child is having headaches.
It's uncommon for children, especially preteens, to have headaches. And if your child has a headache that is not associated, say, with fever or some sort of upper respiratory illness, the child should be evaluated by a healthcare provider.
Now, again, all of this is rare, but if you see any of those symptoms, it's a good idea to talk to your doctor.